Okay, we've been sent a case here. Looks like an XG3D scan for missing teeth number 7, 8, 9, 10. So the first question I'm going to ask in this particular case is what type of guide are we going to be using here? And the reason I ask that is an OptiGuide is not going to be a good option for us. And the reason being is that we have full coverage restorations on all these teeth except this single molar here and even all the lower teeth. So to get an OptiGuide to stitch here is going to be very unpredictable. It may work, but it's going to be unpredictable. So in this case, what I would suggest is a upper stone model and a scan with the Sirona bite plate registration in the mouth, so to have a surgical guide made. My second comment on this case is going to be we don't have any virtual tooth data here. So in this particular case, we have two options to getting tooth data in the scan. And let me back up for a second. The reason we would want this tooth data is to help us plan the implant. To give us an idea, for example, if I took a look at this implant in site number 9, I could put that implant there, it's in bone, there it's in bone, and even there it's in bone. But each one of these has a different prosthetic outcome. So my preference is for us to have tooth data here. So the two ways that we can get tooth data, one is we can do a virtual CEREC wax up, but again, that's going to be predicated on being able to integrate the data, which we have said that becomes complicated because we only have one tooth to work with here. Or the more predictable and probably the more ideal solution here would be to have a scanning appliance fabricated with a barium sulfate wax up done. In other words, the lab will do a wax up 7, 8, 9, 10 to ideal position, ideal occlusion. Looks like we may have a little bit of a class 3 jaw position here to ideal occlusion. And then they will duplicate that in barium sulfate, and then you will actually place this appliance in the mouth and scan the patient with that in. So that will allow us to have the virtual wax up. So that leads me to our next point, which is that doing an implant plan here will be a bit difficult without having any tooth data here. So we're going kind of blind here, basically placing the implant where maybe bone is, but not knowing where the tooth is going to be. And then what that does is it may put us in a prosthetically difficult situation here. So let's go ahead and talk now. So in terms of the implant plan, we want to plan to replace 7, 8, 9, 10. My experience has been is that we won't have enough space to be able to place 4 implants here. And the reason is between implants and teeth, we need 1.5 millimeters to 2 millimeters of space. Between implants, we need 3 millimeters of space. And between implants in site 8 and 9, we need approximately 4 millimeters of space to be able to maintain that papilla, the bone which maintains the papilla. So by the time we add all these numbers up, we simply typically do not have the ability to place 4 implants in this site and maintain the bone and maintain the soft tissue. Now, the soft tissue may not be that important and we may be able to fudge, but my preference is we take a risk of losing bone in between the teeth. So let's do this in this particular case. Since we have some limitations that we don't have a virtual wax up, let me give some critique based on the plan as it is. So if we take a look at site number 7, my critique is that we are too thin right here and unnecessarily too thin there. By that I mean I know we can graft this area, but what I'd rather see us do is simply move this implant to the lingual. Now we've created enough space, and then we can tip or tilt the implant as necessary. So now this becomes a better implant position. The other thing is I think it needs to be tilted like that as well. So now we've gone from an implant plan like so to an implant plan like so. So we probably wouldn't need to do any grafting here. I would guess that this implant should work here. I would maybe consider the 3.0 implant in this particular site. It's perfectly and ideally made for lateral incisors. However, it's still questionable whether that would give us enough space to place 4 implants here. Okay. So hopefully that makes sense. Bone level position will be very much dependent upon where the bone site heals to. Looks like there's an extraction socket here. And also based on where we want our final gingival margins to be. I'll go and say that based on the plan that you had, that we were definitely at crestal level or slightly subcrestal, which is my preference. Now if we go to site number 8, my guess on this particular plan is that the implant is tilted too far to the buccal. And that's a guess, again, without prosthetic data. It's difficult to know. The other thing that we have to take into consideration here is the location of the Palatine Fossa, which we are right up against here. So I would encourage us to move this implant. So my guess would be this implant would need to come this way a little bit and then be tilted back into position a bit better here. Again, here we are basing this totally on no prosthetic data whatsoever. And now we can see that we're starting to have more space here and greater accuracy as well to avoid any type of vital structure or anatomy. Okay, and now if we move our sights to number 9, we can also see here again, number 9 is going into the Palatine Fossa there. So we need to move that over, get that out of the way. And then from here, this is my question based on the prosthetic data. Right now, my guess would be that we're coming just buccal to the incisal edge. So here we may have the ability to adjust this plan like so, and we may even be able to go to a normal size implant. And I would encourage us to use the Tapered Plus implants, which has a built-in, let me see if it's in here. It has a built-in platform switch, which we don't have in the software. At least at this point, we don't have it in the software. So, I would encourage us to take a closer look. Now, looking at a plan here, if we go to diagnosis and measure, I can measure from here to here, and we are just over 4 millimeters. So I have the ability here to scoot this implant over a little bit and then scoot this implant over a little bit, and now we'll have a 4 millimeters of space. Again, prosthetically, my guess is that's the midline. This implant's too far over. That implant's probably too close. My guess would be without any tooth data, it becomes much more difficult here. And then we'll take a look at this last implant here, and my guess is, again, we took out a tooth that looks to be a little bit of a buccal plate here. I don't know how this is going to heal. I would probably take another scan after healing, but my guess would be that based on experience, this will probably be the more accurate angulation. So hopefully this helps. There's a lot going on here. It's, again, without tooth data, it's very difficult to determine the exact positioning, but my takeaway on this particular case would be that in order to place these implants to replace 7, 8, 9, 10, my guess would be that we would have to do some type of implant bridge, and because it'll be very difficult to get the spacing that we need in this little site. Thank you very much.